I am an admissions officer here for the online programs of applied learning here at Johns Hopkins University Bloomberg School of Public Health. I work with our team here to assist students as they're exploring their options for continuing education. Today, we will be discussing our Master's of Applied Science in Spatial Analysis as well as our Graduate Certificate in Spatial Analysis. I'm excited to be presenting here with Dr. Curriero, Director of the Spatial Analysis Program, and Tim Shields, Associate Scientist. Frank, could you start us off by sharing about your background, and then Tim can share about his background as well afterwards?
Sure, thank you. So my name is Frank Curriero. I am professor in the Department of Epidemiology. My background is really in statistics, and I focus in this area called spatial statistics, which you'll hear a little bit about today. And I've been working in this field for about the last 20 years. Started as a graduate student, and it's a really exciting field. And you see a lot of the stuff in the media, even currently, that we'll show you some slides today on that really support this whole idea of location information and spatial analysis. So I look forward to sharing some of this with you and then taking your questions at the end.
Tim, could you share a little bit about your background with us, please?
Sure. I'm Tim Shields. I have a background in geography, and I've been working, I guess, with GIS methods and applications in public health for 20-some years. Frank and I have been working closely over the last years and a number of years as well. Also, looking forward to this discussion today. Excited for you to hear about the program and hope we can shed light on your questions that you have.
Awesome. Thank you both for your introduction. To give everyone an idea of what we'll be covering today, Frank will take us over an industry overview for spatial analysis. He'll go into program details and curriculum. This program is fully online, so we'll give you an insight as to what it looks like to be in online learning here at Johns Hopkins University. Faculty will also be highlighted. I'll go into admissions requirements, tuition, and financial aid, details about the scholarship we offer. We will save time at the end of the presentation for Q&A, so feel free as you are listening to the presentation, if you have any questions, please type them into the chat box and we will cover those at the end. Thank you so much for your time, and Frank, please feel free to start.
Great, thank you. So let's start off very simple. What is spatial analysis? Well, you know, it really means different things to different people, and it can really depend on, you know, where you're thinking about applying and what industry you're in. Some building blocks of what spatial analysis is, the interpretation of geographic information through the use of mapping software and statistical analysis. Okay, it builds on foundations we have in epidemiology and biostatistics. And for us here at Hopkins, spatial analysis includes this overarching paradigm. So it includes components of spatial data, geographic information systems, and spatial statistics. And you'll hear me talk a little later about spatial statistics, because that's a component that's kind of unique to our program here at Johns Hopkins. So where did it all begin? So let's give you a little history of spatial analysis. So back in 1854, John Snow's famous cholera map. This was an outbreak in London, and he was sort of known as the father of epidemiology, and maybe the first scientist to actually map health outcomes and use this idea of location information and the whole idea of spatial analysis. So at the time, cholera was thought to be an airborne pathogen and transmitted through the air, and he mapped out all the outbreaks of cholera in London, and you see the maps there up on the screen. And he noticed that a lot of the cases were clustering around this water pump where people would go and get their water supply on Broad Street. And this all led to now cholera being a waterborne disease rather than airborne. And very famous study, and you know, the landmark of where this water pump is highlighted in London. I think there's actually a pub there right now, but there's a sign outside there, and very, very interesting study that really kind of kicked a lot of this off about how we can use location information to help in public health. but now we jump ahead a little bit more than a century, and this is sort of what we can do now with spatial analysis. So this was a project that Tim and I and others here at the school were involved in about predicting malaria risk. And what you see on the map here is you see 4 maps, and each of those maps go together. The ones on the left with the ones on the right. So on the left-hand side, we're showing the risk of malaria, both in the dry season and the rainy season. This is in Zambia in southern Africa. And on the right-hand side, you have a map of predicted risk uncertainty. So these are using advanced statistical methods, spatial statistical methods, to estimate malaria risk and malaria and the uncertainty in those risk predictions. And just an example of some of the more advanced, fancier things that we can do now in spatial analysis. And at the bottom there, I just give you the reference to the paper if anybody wants to go in and read more of the details on that. Just to give you some examples of where you might see spatial analysis used both in the media and the literature and so forth. This is just showing you trends in U.S. obesity rates between 2011 and 2015. So you see a series of these temporal or time-scaled maps. This was based on the Behavioral Risk Factor Surveillance System. So this was coming out of CDC. It's a telephone survey that they started back in 1984 with 15 states. And now it includes all states, and there's more than 400,000 interviews that are done annually, and they collect this information at the state level, and they go ahead and now you're mapping a lot of the different outcomes that the surveillance system is collecting. So some further examples of what you might see spatial analysis in the media. This was the top one is just an article about food access improved for WIC participants, which is women, infants, and children, using spatial analysis. So it was all about access to healthy foods and where we could put where would be the best place to locate a healthy food outlet that could get to most people. And then the study at the bottom here, this was something we call in spatial analysis cluster detection analysis. This is looking at hotspots of malnutrition across India. And here you can see the identified hotspots of malnutrition and so forth. So just some examples of what you might see spatial analysis in the general media. Then clearly what we're all dealing with across the world is the pandemic of the novel coronavirus. And this map you see up there highlighted is this actually came out of Johns Hopkins and the Department of Engineering, where they posted these maps and posted all the cases. This is something that is updated daily, usually hourly. Okay, and it shows you down the bottom left-hand corner. I just grabbed the one from a couple of days ago, but I give you the link for this one at the bottom. And other universities and agencies have similar mapping and for the coronavirus. And I just want to say that this display here, it's simplified in terms of what spatial analysis can do, but it's so profound of a message and provides such usable information in real time, basically. And so having resources like this to help deal with and track infectious disease, like what we're all dealing with currently, is so useful. And this is the starting point of spatial analysis. And so it's unfortunately an exciting example of what spatial analysis can do with some current issues that the world is facing with. So why spatial analysis? Okay, well, because the uses for geospatial technology are so widespread and diverse, they're saying that the U.S. Department of Labor is saying that the market is growing at an annual rate of almost 35%. There's an increasing demand for readily available, consistent, accurate, complete, and current geographic information and widespread availability and use of these advanced technologies that that access and utilize this information, and it's offering such great job opportunities for people with many different talents and educational backgrounds. So you don't need to have, a background in geography or a background in statistics. These are the tools that we'll teach you during this program. But everybody nowadays is using location information, using maps, and so forth. And so that's what this field of spatial analysis really speaks towards. There's been some articles out there, and some articles that actually helped kick off, this idea of Hopkins having a applied master's degree in this field of spatial analysis. And I know Hopkins went and talked to a bunch of different health departments and health agencies and was asking them, what is it that your people would need? What is the next field that we all should be considering? And spatial analysis was one of the ones that got highlighted a lot. Here's an article, with a great catchy title, what gets measured gets done. And that is so true. And looking further inside that article, it talks about leaders can recognize that there is this urgent need for more timely and more geographically specific data at the neighborhood or community level. Sometimes we call that a census tract level, which is just a census geography. But at the local scale, neighborhood or community, to efficiently and effectively address the most pressing problems we have in public health. And of course, with the novel coronavirus across the world, this is so much more highlighted now, that the need for this neighborhood level information is so much more important. So we can measure it, and then we can start doing some things. So it gets back to what gets measured gets done. So what can you do with a degree in spatial analysis or expertise in spatial analysis? So there are a number of career paths, and some are narrowly focused and more are more general or encompassing. And you can almost think about it as an added benefit to what you're currently doing. So it's not that you have to change what you're doing completely. You can if you want, of course, but just having that niche now with expertise in spatial analysis and GIS software and spatial statistics, there's so much you can do. Just a short list of some possible job title examples: environmental health officer, a GIS software developer, cartographer/visualization specialist, a geographic information scientist, a geospatial data administrator, and then of course being a spatial statistician. These are just a short example list of some of the career paths that you could go in or add to your current career path with expertise in spatial analysis.
Frank, maybe I should interject a little bit here, just on the job titles, because looking at that list, I think about often our students ask us for references for new positions, and looking through some of those requests, there's been I don't know, 3, 4 of them who have taken on faculty positions, so that we don't put on our list here. And I see a data analyst and some GIS tech positions as well. So just more job titles to add to the list there.
Yeah, and that what Tim was saying, we often get asked for recommendations, and we follow up with our students to see where they've been. Like Tim said, some are at universities and faculty positions, some are at health departments, CDC, these kind of health agencies that are really interested in hiring people with expertise in spatial analysis. So I'll give you some program details. So, this program offers both a Master's of Applied Science, which is a 2-year program, or a certificate in spatial analysis, which is just a 1-year program. The Master's, the 2-year program, it's 15.5 term credits, and we have 4 terms in each of 2 academic years. So we don't run on semesters. We run on what's called 8-week terms. So we got 4 of those a year. And the courses involve professional development plus there's this thing called an integrative activity, which I'll talk about in a little bit. But so there's a lot of spatial courses: epidemiology, biostatistics, professional development, and then we have this capstone or thesis type integrative activity component. The certificate is just 1 year, so it's 4 terms. and it's just 18 credits, and you cover the full suite of the spatial analysis classes that we have. So folks that come in to the program with background in epidemiology and biostatistics already and just want the spatial part of that will take our full year coursework series in spatial analysis. And then those who don't have the background in epidemiology and biostatistics can go for the full 2-year master's. Between the master's and the certificate, it's important to say that the suite of spatial classes that we have, the 6 or 7 of the spatial classes, that spatial analysis classes that we have, they're the same classes that are taken by both those in the certificate program as those in the MAS. So you'll be in classes with mixed students, which so that there's not special classes for the certificate program versus the master's program. So a lot of these courses, they're skill-based orientation for working professionals. It's part-time, 100% online. There's group learning, peer assessment. It's all skills-oriented, so project, examples, hands-on learning. And the goal here is to prepare students to address public health problems through a multidisciplinary approach, applying the latest scientific knowledge focused in spatial analysis. So here's what the curriculum looks like. So you can see year 1 and year 2, and then in each year you have these 4 terms, these 4 8-week terms. Now I'm not going to go and list all the courses, talk about all the courses on there. I'm just going to highlight some of the bigger ones. So you figure in term 1 you've got spatial analysis for public health, right? That 4-credit class. That is going to be teaching you the GIS software, which right now is the ARC Pro. It's an ESRI is the company that makes ARC Pro, and that's probably the most popular software out there. Term 2, you take spatial data technologies for mapping. Okay, this is talking about all the advanced technologies about obtaining and collecting spatial data, whether you're going to get it from a remote sense satellite, whether you're going to collect address information, whether you're going to have a GPS device or other type of tracking devices. How do you get that information and bring it into your GIS? So those are the 2 prominent spatial classes in year 1, and then you follow that up in terms 3 and 4 with an introduction to EPI and a public health statistics 1 class. You'll see some of the other courses in there because every term you're taking 2 courses, like a 4-credit class and then a 2-credit class, and these 2-credit classes are great classes. They're supportive classes. So you see about professional development, seminars in public health, advanced topics about seminars in public health, writing for results. You also see a spatial analysis lab in the last term of the first year because we want to get you going with continuing to work within that GIS software. That's year 1. Year 2, you will start off with a public health statistics 2 class. So just following off of that one. And then in term 2, you have your second epidemiology class, and you also see you have a spatial analysis lab in there as well. And then terms 3 and 4 of your last year, you'll take applied spatial statistics. And along that, you'll also have a journal club class in spatial analysis. And then the 4th term, you'll start taking 2 bigger classes, one on spatial applications, which is furthering your knowledge in spatial statistics. And then there's this integrative activity class, which is a class designed solely towards that thesis. So you're going to be writing a capstone. It's not necessarily a thesis. You're going to be writing a capstone project. And just to make some comments here is, before I forget, so you'll see some of these classes that are starred or asterisk. So you can see up in year 1, terms 1 and 2, spatial analysis for public health and spatial data technologies for mapping. Those ones that are starred, or those are the classes that the certificate students are taking. Okay, so in their only year, they will take a spatial class every term. Okay, so the first 2 terms they'll be in one cohort, and then the second two terms they'll be in a year 2 cohort. And so they're taking the same classes as the MAS students, which is important. And another thing here that I want to mention is this idea about spatial statistics. So we have 2 classes on it: applied spatial statistics in your 3rd term of your 2nd year, or 3rd term of your your certificate year, and then spatial applications following that in fourth term. This is something that really separates our program from other either online or on-site programs throughout the country and throughout the world, actually, because a lot of people, when they talk about spatial analysis, it's mainly about getting to and manipulating the map, okay, and sort of like that coronavirus dashboard that we showed earlier, and but spatial statistics, that's all about analyzing the map and interpreting the map and understanding the clustering behavior that's going on with whatever you're mapping and linking the outcomes on the map to other determinants that might be happening or varying spatially as well. And that's what the whole field of spatial statistics is all about. And so it's sort of like how we can go beyond the map in a sense. And that's something I don't see a lot in other programs. So that's certainly a big selling point for our program here. So online learning at the school. So, we have 20 plus years experience in online learning. The courses are developed with high production value. So Tim and I spent months down in what we call the basement at our university, and it's all these soundproof studios, where we go in and we would record lectures. So all our lectures are recorded for increased flexibility for the students. So you can pick them up and listen to them whenever you want. But we record them. Tim and I recorded our lectures over a series of these 6 or 7 classes, and then the online learning crew, the production crew, polishes them up. I mean, obviously they're not adding any content or anything like that, but they're taking out all the uhs and the ahs and all that kind of stuff. So it really comes across as a high production value. And like I said, they're recorded, so it increased flexibility. And we have a lot of activities with the students to keep them engaged. So it's not just that, we give you all the recorded lectures and say go. We usually have what's called live talks throughout the term. Usually every other week we'll have a live talk where Tim and I, whoever is the primary instructor for the class, will get on at a set time and for an hour and talk to the students live and get questions live about what might be going on in the course and so forth. And Hopkins also has a 24/7 help desk for any of their online issues that you might have as a student. So back to the esteemed faculty. Okay, so working left to right on the top row, that's me. So my background is in spatial statistics, so I will teach those classes. You've got Dr. Elizabeth Gollop, who is the director for all of OPAL, and she's an epidemiologist, so she teaches some of the epi classes. You've got Dr. John McGreedy. He is the biostatistics expert, so he is teaching the 2 public health statistics classes. Derek down at the bottom, he's also epidemiologist, so he will share some of the teaching of the epi classes with Dr. Gollop. Tim is geographer by training, as you heard, so Tim will talk about or teach the GIS classes and the spatial data technologies classes. And then Dr. Chandran, she's actually an epidemiologist by training, and she teaches a lot of the professional development courses and the seminars in public health, which really give you a breadth and depth about what can all go on in public health. So these are the instructors for the program. Like I said, you'll interact with us through various courses and live talks and discussion forums and the like.
Thank you, Frank and Tim, for all the insight into the spatial analysis program. For those that may have joined us after the start of the presentation, please make sure to type in your questions in the chat box for our Q&A at the end. I am going to take some time to go over the admissions requirements. All of our applications are processed online through Sophis and Sophis Express to streamline your application process. Sophis is used for the master's application, and Sophis Express is used for the certificate application. The requirements for education is a bachelor's degree from a regionally accredited college or university. We are looking for sufficient prior quantitative coursework or professional experience as an alternative evidence for quantitative ability. Current resume or CV. You will need 3 letters of recommendation if you are applying to the master's program and 1 letter of recommendation for the certificate program. A statement of purpose is a big part of both applications. It's where you will state to the committee why this program, how this program matches up to your career goals and the educational objectives that you're trying to fulfill, and how you hope to apply this into your career and into your future. For our international applicants, if English is not your first language, you may need an English proficiency exam. We accept either the TOEFL or the IELTS. For those who have obtained education outside of the U.S., for your academic records, it is a requirement that you undergo a course-by-course credential evaluation via the World Education Services. You can see on this slide that we've shortened it out for WES, which stands for World Education Services. I encourage you to review those requirements for WES to see what they require from your university and how your university should send those records to them directly. We are very used to working with students on the Office of Admissions here. If this is something that you need or have questions about, please feel free to reach out to us first so we can get you connected to the right resources and websites to get you started in that process. Looking over the admissions information, our applications are reviewed on a rolling basis. We are currently open for the fall of 2020, which the start date is August 31st of this year. Meaning that ongoing rolling basis, meaning that you do not need to wait till the deadline's posted on this slide to hear back from the committee with your decision. We encourage students to apply early, so if you receive your decision early. Our priority deadline is April 15th. Our final deadline is June 1st for the master's program. And then for our certificate program, the deadline is July 1st. We are here to assist through the application process. So if you have any questions, you have a support system with us. We only enroll 1 time per year, so it's important to know if you're excited about this program. We only have 1 start each year. And if you're interested in starting in the fall, but not sure if you want to commit to a full course load, you do have the flexibility of starting 1 class at a time. To provide insight on the investment of school, right here is listed all our financial information as well as some information about our financial aid office. For those who are eligible to utilize other financial resources such as FAFSA or private loan information, feel free to look at our website or email or call them. The information is listed on this slide right here. For the 2019-2020 school year, the tuition is $1,162 per credit. We do offer an OPAL scholarship, which is a partial scholarship specific to these programs that covers $446 per credit, which leaves students responsible for the remaining $716 per credit. If you're admitted into the program, you're automatically awarded the OPAL scholarship. There is nothing additional that you need to do to receive it. So if you're planning financially, you want to plan for the $716 per credit at the current tuition rate. Any changes it will be updated on our website in the late spring, keeping in mind that our tuition rate and scholarships are reassessed each spring. And just to go over the credits breakdown, it is 50.5 credits for the master's, and for the certificate, it is 18 credits at $716 per credit at the current tuition rate. Now we have time for a Q&A session. We have a couple of questions that have come in already, but please feel free to type in your questions into the chat box if you have not already. First question here, if a student has a GIS background, could they take some master's classes if they're interested in applying for the certificate, such as if they have an interest in like epidemiology or the public health statistics in that second year, or other courses in that second year?
These are reviewed on a case-by-case basis. So I would definitely inquire about that earlier than not. We usually try to accommodate as best we can, but the timing has to, of course, work. And we would have to ensure that that whatever prior background you have, for example, in GIS, is sufficient enough to get you through the courses that we teach in GIS. So yeah, that's definitely something that I think I would suggest you separately inquire with the program, which eventually that email request will come to us and Dr. Golub, and we can assess those on a case-by-case basis.
Frank, I may just add to that, like, specifically for the GIS class. I know a student last year had 10 years of GIS experience. It was their full-time job, and was interested in opting out. And we talked about it and got him linked up to take a different course in its place. And at the end, he said no. He switched his mind, changed his mind, and came back and took the course. And afterwards, he wrote to me and he said he's glad he did. In the beginning of the GIS class, you're learning GIS and where the buttons are and what the functions are and what the concepts are. So that was not too informative for him. But as soon as we got into the case studies with all the public health applications involved in it, that's where he said he was glad that he stayed with taking the GIS class. So we can have that discussion on the case-by-case basis, but there's a little more to the GIS class in versus the classes in general.
Awesome, thank you. As a follow-up to that question, do you see room for the certificate program with someone without previous specific epidemiology experiences or backgrounds, such as an environmental health background?
Yeah, again, I'll go back to a case-by-case basis because we want to get more details about your background and making sure that having something like an environmental health background won't stop you or make too much of a challenge for you when we're doing some of the public health related analyses. So again, we try to be accommodating as much as we can, and we understand that we have a lot of these special case scenarios. So so what I can say is, sure, we'll be open to considering that, and would want to find out more details and so forth. So again, contact us separately, and we can work through those details.
Okay, perfect. For applications, do you see applications for spatial statistics or GIS in public health beyond epidemiology, maybe within your courses?
Yeah, so people who take our classes on site are a mix of people in epidemiology, people in environmental health, people in molecular and microbiology, so more of ecologist type folks. We have people in population and family development. I'm just going through the departments that we have at the school. Also, a lot of the health behavior and society and health policy management type students, where they're not hardcore epidemiologists, but they're looking at behaviors of people and why people make choices, healthy, unhealthy choices, and so forth. At the school here, everybody pretty much takes one or two classes in epidemiology, and that's what we're trying to mimic in the program is giving people sort of that background in epidemiology. But you're not going to come out of this program having taken those two epi classes calling yourself an epidemiologist. That will provide the background for your degree in spatial analysis. But again, getting this information, on a case-by-case basis is how we like to move forward with decisions about how people best fit in the program, whether it's a 2-year master's or the certificate program.
Okay, thank you. Our next question we have, is there an expectation with students coming in from different backgrounds, let's say per se like a business background, in their undergrad or their master's, is there an expectation that the admissions committee is looking for in students' backgrounds, if that makes sense?
Not necessarily, because we understand people are coming from different backgrounds and they're coming to a spatial analysis program. So we have no expectations in terms of how much spatial analysis you might know prior to coming in. In fact, we expect you don't know any. You've never worked on a GIS before, so we're going to teach you that kind of stuff. We do like to hear about you in terms of that statement of purpose that you'll have in your application about why are you thinking about spatial analysis, or where do you think spatial analysis can fit into your current career, and so forth. So we like to see students that have some ideas about what spatial analysis is, and how it can be included in their careers. But we've had a variety of applicants in the past. Tim, your memory probably serves you better than mine. We had firefighters, we've had nurses, we had people in law enforcement.
And then we've had financial people from like Australia and New Zealand. Yeah, we've run the gamut of backgrounds.
Yeah. And that's the beauty of spatial analysis. It can fit into so many different areas and be used by so many different areas of expertise as this added benefit component.
And just to clarify, the student background, whether if they're applying for the certificate or the master's, they're still required to have some sort of quantitative ability.
More so for the certificate, because the certificate, you're not getting the biostat classes. So we need you to come in with some degree of quantitative skills in the statistical sciences, some experience to that. For those taking the master's program, again, it varies. You have 2 biostat classes in the master's program. You also have the 2 epi classes, which have some quantitative content to them as well. But we do like to see people coming in with some undergraduate and or graduate work in math and statistics, to have some degree of experience in it. I'm not saying high level stuff. An introductory course or 2 would be fine if you're taking the master's program.
Okay, perfect. Could we go into some of the different softwares and applications used within mapping that is used in the program?
Sure, I'll let Tim start with the GIS software.
Sure, we've been using ESRI software, ArcGIS. The course was built in the desktop environment, and we've migrated it to ArcGIS Pro, since that is the way the industry is going. So so for GIS, we will stick with ArcGIS Pro. I guess GIS concepts are the same no matter what the GIS software is. So we actually do I think there's an assignment, we download QGIS, and we kind of replicate one of our earlier exercises in QGIS, just as a, just to show everybody that, hey, the concepts are all there, even though all the buttons are in different places. So GIS-wise, it's ArcGIS. Are you talking beyond that, or are you talking just GIS?
Well, I'll let you handle the GIS part, and then I'll transition over to, for the actual spatial statistical analysis of the spatial data, we use a program called R, very popular, free and open source program, which has tremendous functionality and capability for doing spatial analysis. There's some software out there, there's other software out there, but R is probably the most powerful. So we'll do a lot of stuff in R. We'll switch to software called StatScan for cluster detection. We showed an example of that in the slides here, looking at the malnutrition clusters. That was in one of those media slides. So those are the 2, but predominantly in R. And so like I said, R is free and open source, and as part of the program, you'll get site licenses for the GIS software that Tim talked to as well. So there's no buying of any software on a student's part.
Perfect. If a student is looking into pursuing a PhD afterwards, is that a pathway for them if they pursue this program?
I know we've had a couple people use this as a stepping stone to a PhD program. I'm not saying this is not necessarily a guarantee that you'll get into any PhD program, Hopkins included, but this is a master's degree. It's a great master's degree from one of the best universities, from one of the best public health university school in the world, and I can't imagine it not being looked at as a benefit. You might have, depending on what field you go into as a PhD, you might have to further take some other epi classes or biostat classes, depending on how quantitative or epi your PhD program is. But this is a solid master's degree that I think will serve you well in that pursuit.
Yes, we have another question, and we're kind of coming down to the time here, but so what can candidates do to strengthen their file and their quantitative ability if it's not as prominent, with that quantitative ability that you're...
Yeah, that's a question. So two things. First of all, the statement of purpose. I know there's some guidelines for how to write that, and please pay attention to those, because when we read them, and yeah, it's Tim and I, some other faculty that read these, that look at these applications and read those statement of purposes, and that's where we're really looking for the student speaking to us about, why spatial analysis for you, and what do you understand right now as spatial analysis to be. So I would strongly suggest talk about spatial analysis in there, along with all the other guidelines that they do. And then, God, I lost the question. Okay, what can students do to further their quantitative skills? So there are a lot of online courses, Coursera courses, whether or not you want to take a summer course at a local university or community college, or take one of these online biostatistics courses. Those are free, I believe, or you might have to pay a little bit to actually get the certificate that say you finished it. So there's things like that students can do if they think their quantitative skills, if they think strengthening their quantitative skills will really do them well on the application. So yeah, I would say maybe looking into taking some of these Coursera online courses, or an actual summer course or semester course from a local university.
Awesome, thank you. We have one more question before we wrap up. The question is, what are some of the leading companies that hire for spatial analysis if someone's looking to go into this program?
Yeah, that's wide ranging. I'll talk a little bit. I'll let Tim come in for his experience as well. But health departments, local, state health departments. They're big on hiring this. Any kind of health agency, CDC, FDA, EPA, all these government agencies are looking for people with expertise in spatial analysis. I mean, it's just a field that is out there so much. There are a lot of nonprofit health-based organizations too that look for people with expertise in spatial analysis. And it's not just in health, although we're talking about health and our program is obviously focused on spatial analysis for public health, but spatial analysis has just as a strong appeal outside the health arena as it does within the health arena. Tim, did you have anything to add in terms of companies and agencies that'd be interested in hiring people with spatial?
I think you hit the big ones with health departments, both I know county and state level. Also, EPA had hired some of our students. The Department of Homeland Security had just hired one of our students. But also in the private industry, I know there's under the umbrella of big data. I remember one of our students was through her integrative activity caught the eye of this big data company for working on opioid surveillance. So I know there's private entities out there. I think a lot of the students, a number of them come who are already working with some kind of job where spatial analysis augments what their job already is. Others use this as a stepping stone to jump into a different position of some sort. So that's going on. And I guess a lot of these students come in with preconceived plans, and others are developing as the program, as they go through the program.
I'll also add that universities too. So not so much looking for a faculty position, which we've had some of our graduates certainly do. have done. But but a staff position. There's a lot of research projects that are going on in universities, and they're looking to hire staff, spatial data analysts. To get involved in a project and lead and perform all the spatial analysis for that project. So those are exciting positions as well to get involved in, and you would certainly be qualified with our certificate or master's program to pursue some of those opportunities.
Awesome. Thank you all for your attendance today. If you have any other questions, or if you didn't get to your questions, we'll be connecting with you offline here at the Office of Admissions. We'll contact you directly within the next few days to assist in answering those questions. If you want to connect with someone immediately, my contact information is right here on this slide. Feel free to reach out via email or directly call me. If you're excited about this presentation and see this as part of your future, please feel free to use the scan code here to move forward with your application. I hope you're ready to move forward and apply. We have a dedicated admissions team here looking forward to working with each and every one of you throughout the application process. Thank you, Frank and Tim, and thank you all for joining us.
You're very welcome. Hopefully we get to see a lot of you guys' applications. We'd love to have you in the program.
I'll just say ditto to that. Yeah, thanks for attending, and if you can answer any other future questions, just let us know.
Talk to you all soon. Thank you.